Hello everyone. Today we will be discussing about Bishop score. Okay, Bishop score is very important. You all know cervix undergoes lot of changes during the labor pain, and some of the changes can be present before the labor starts. Okay, it is possible, and if all those changes are present before the labor start, labor is going to be a easy for that patient, right? Cervix changes will come early in that patient. So what all are the cervix changes occur, and what all are the factors affecting the cervix changes is included in the Bishop score. So here I would like to tell you that Bishop score has nothing to do with whether normal delivery will occur or not. It is all about that cervix will undergo that changes or not, or whether some changes are present beforehand, and when we will induce, then of course if some changes are present beforehand, then of course the cervix changes will occur fast, and if there are not no any changes present, then of course all the changes will happen late. Okay, so it Bishop score is all about assessing the cervix changes, nothing else. Okay, so let's see the questions which have come in the last year. Calculate the Bishop score. 30 years old, admitted on examination. Cervix is 1 centimeter, 30% effaced, soft and posterior, and vertex at -1. Here they have asked us to calculate the Bishop score. Though it is a tough job, and all this such a deep is not expected from you all, but still I would like to tell you here that if you will focus the attention here for a few minutes, you will be able to do it. Okay, because I'm going to tell you in much easier way. Next is not a component of Bishop score. Cervical length, cervical position, type of pelvis, cervical dilatation. Yes, cervix, each point is almost there in the Bishop score, but it is not the type of pelvis. Okay, so type of pelvis is not a component of the Bishop score. So answer is this, type of pelvis. Okay, so now enough of discussing the things here and there. Let's start with Bishop score. Bishop score is also known as pre-induction score, because we assess what all are the cervix changes have already occurred, and we will come to know how fast the cervix changes will occur. Accordingly, we will titrate our induction agent drug we will think of. So it is done before the induction of labor to assess the cervical status. Okay, it has 5 components. 4 are about cervix, and 1 is the station of the fetal head, because you know that this fetal head gives lot of pressure on the cervix during the contraction, and that causes changes in the cervix. So 4 points are about the what all changes have occurred in the cervix. They are about the cervix, and 1 is station of the fetal head, because if head is lower, then along with contraction it is going to put a pressure. For example, my this hand is cervix and this is fetal head. Now if the head is high up, then of course it is not going to make any contractions are not are going to make less changes to the cervix. But if the head is down, then these contractions will influence the cervix which is nearby, and the cervical changes will occur fast. Okay, so now let's study let's study the components of the uh, Bishop score and how we give them score. Okay, so you all know the first component is cervical dilatation. You all know cervix dilate up to 10 centimeter to expel the fetus. So, and this is the most important component. Most of you did wrong today when this question was asked in the quiz. Most important component is cervical dilatation, and as you all know, in the part O also we give a lot of preference to this, and this is the most important component of the Bishop score, cervical dilatation. Okay, how we are going to give the score on the basis of the cervical status? So to some component we give a score 0, 1, 2, 3, and to the some components we give 0, 1, 2. Okay, because cervical dilatation is a cervix has to dilate up to 10 centimeters, such a long dilatation, so we have given the score up to 3. Okay, so we give the score 0 if the cervix is closed. If we give the score 1 if the cervix is 1 to 2 centimeter already. We give the score 2 if the cervix is 3 to 4 centimeter, and we give the score 3 if the cervix is 5 plus dilated. Okay, so in our first question here, you can say that you can see that here the cervix was 1 centimeter dilated. So how much score we will give? Okay, here I will write down that we studied. We will give the score 0 if the os is closed. Okay, we will give the score 1 if the cervical os is 1 to 1 or 2 centimeter. We will give the score 2 if the cervix is 3 centimeter or 4 centimeter. We will give the score 5 if the cervix is 5 or plus 5, 6, 7, 8, 9, 10. We will give the score 3. So here the cervix is 1 centimeter. It means that we will give the score 1. Right, so this is about the dilatation, and it is the most important component and how we will give the score. Number 2 is cervical effacement or cervical length. There are two type of Bishop score. Here I would like to tell you, one is Bishop score and one is modified Bishop score. The difference between Bishop score and modified Bishop score is that traditional Bishop score contains cervical effacement, whereas the modified Bishop score, instead of cervical effacement, it contains cervical length. Okay, so you all know that cervix, it get merges into the cervix length shortens, or you can say the cervix merges into the lower uterine segment or the isthmus. Okay, when the labor occurs, okay, cervix open. I already remember my teachers used to tell like this, that my arms, these are uterus, and my hands are cervix. Now as the cervix open, now this is opening, it is closed cervix, it is opening, so it will merges. See, it is merging in the lower uterine, and once it opens 10 centimeter and totally merges in the lower uterine segment, then the fetus get expelled. Okay, so how much that cervix has merged, more the cervix get merged, lesser the cervix length comes. Okay, okay, so in the starting the cervix length is 4 centimeter and cervix hasn't merged into the lower uterine segment. So this is how we give the score. Okay, already the score to learn is bit difficult, but I have made easy for you. Let's see, we give the score 0 if the effacement is 0 to 25%. Okay, and if it is 25 to 50, we give the score 1. If it is 50 to 75, we give the score 2, and if it is 75, more than 75%, we give the score 3. Okay, easy, 25, 25, 25. Though it is modified by me, but still it is easy to learn and it's more practical. If we see the length, how we score, give the score to the cervix length. Okay, if it is the cervix length is 4 centimeter, then we give the score 0, and if it is 3 centimeter, okay, then we if it is 3 centimeter or 2 centimeter, you can say, then we give the score 1, and if it is 1 centimeter, then we give the score 2, and if it is less than 1 centimeter, then we give the score 3. Okay, so this is how we are giving the score. Here it is, two numbers are here. Okay, it is not 4, 3, 2, 1. Here in the one score, two number are there, you have to keep in mind. Okay, so next it is that, next about it is cervical consistency. Okay, as you are and now you know that the cervix has to merge into the lower uterine segment, so cervix has to become soft. Originally the cervix is firm. It is the cervix texture is same like our nasal cartilage, but when the cervix undergo changes, cervix becomes soft. Okay, so here we are going to give only three scores: 0, 1 and 2. 0 for the firm, 1 is for the medium, and 2 is for the soft. Okay, so simple is the cervix consistency. The third component which we are going to learn is the cervix consistency. Okay, 0 is for the firm score consistency, it is for the firm score, and 1 is for the medium, and 2 is for the soft. Okay, so no 3 score for the cervix consistency. Okay, next is in the last last cervical component which we have to assess is the cervix position. You all know normal uterus is anteverted and cervix is posterior. Okay, uterus is anteverted and cervix is posteriorly. So when this cervix has to expel the fetus, cervix has to come interior. Okay, so that fetus can be expelled. So if it is posterior, the score is 0, and if it is 1, the score is midline, and if it is 2, then we give a score 2 if the cervix is interior. Okay, here I would like to emphasize you the thing that in the last INS set a question was asked, what is preterm labor pains. They have given a lot of things in A, B, C option, and in the D they have written cervix posterior. So the answer was that D option, because if cervix is posterior, then less likely is that the patient is suffering from labor pains. You can see here, the normally the cervix is posterior, but if the cervix has to expel the fetus, cervix has to come interior. So these basic things they can score you in an indirect way also. Okay, so here I was telling that here we will making our own chart. Okay, so this was about the cervix position. Okay, cervix position, so it is posterior, okay, or it is mid, or it is anterior. Accordingly 0, 1 and 2 marks we have done. And the starting only I tell you that station of the fetal head plays a role, because more the head is down, more the cervix will easily undergo changes. So other than the cervix 4 component, the fifth component is the station of the fetal head. When the head is at the ischial spine, the station is 0. If it is above, it is -1, -2, -3. If it is above -1 centimeter from the ischial spine, it is -1. If 2 centimeter above, so it is -2 station, and if it is below 1 centimeter, then it is +1. Okay, so that is how we give this score. See here, so yeah, here, so here again we give the score 0, 1, 2, 3 to the station. So if the station is here again we give the score 0, 1, 2, 3. Okay, if the station is at -3, we give the score 0. If the station is at -2, we give the score 1. If the station is at -1, or you can say if the station is at 0, then we give the score of 2. And if the station is at +1 and +2, we give the score 3. Okay, so this is how we give. So in this question which we were doing, the cervix was 1 centimeter, it means the score is 1. If the cervix is 1 centimeter, right, and it is 30% effaced, so it means again that the score here is 1, right? See, you can see here that 25 to 50 was 1, 1. So here again the score is 1. Okay, and it is soft and posterior. Soft means 2, and posterior means 0 and vertex is at -1. So it again means 2. -1 means 2. Okay, -1 means 2, right? So here I would like to tell you that the total score becomes 2 to 4, 5 and 6. So here the answer will be 5. But yes, why not 5 score is there? Because we have modified this was something like 0 to 30, 30 to 50, 50 to 70, 70 to 100. So it was something like that. We have modified a bit, so that is why the score is coming 6 rather than 5. So but still we have calculated it near the answer. We have reached the answer. That is more important. We should reach to the answer. Okay, so that was about the bishop score. Okay, for this was in detail. Okay, if you study that much, it's okay. If you don't study, then you can learn this small slide. Bishop score contains 5 components. Okay, cervical dilatation, cervical effacement, cervical consistency and cervical position. For the mnemonic for that is Delhi officers commonly pollute station. Okay, Delhi officers commonly pollute station. D for dilatation, D for Delhi. Officers is effacement, consistency is commonly, and position is pollute, and station is station. Okay, so this cervical dilatation is scored from 0 to 3. Okay, and cervical effacement is scored from 0 to 3. And you should know that modified bishop score contains length instead of effacement, and cervical consistency is scored 0 to 2, and cervical position is scored 0 to 2, and station is scored again 0 to 3, because lot of stations are there. Okay, so total score, this also has been asked in the quiz today, what is the total score? Because dilatation and effacement are scored up to 3, and consistency and position are scored up to 2. So let's take the maximum score, and effacement is scored up to 3, so total becomes 13. And if the score is more than 6, then it indicates that the cervix is favorable, and soon it will get dilate and undergo all those changes. Okay, so this was about the bishop score. So once again, I would like to tell you the cautious point here, that bishop score never tell us about the type of pelvis, whether CPD will occur or not. It just tell us whether the cervix will undergo the changes of the labor fastly or not, and it has to be done before induction to decide which drugs we have to